U.S. Congress is officially on its August recess right now, and with that, the health care debate has shifted outside of Washington. You've no doubt seen all these videos of heated shouting matches and confrontations, overwhelming town hall meetings across the country. And for the bottom line on those protests, we turn to Chief Washington Correspondent, host of This Week, George Stephanopoulos, as usual. Good morning, George.
Good morning, Kate.
So it's been really remarkable watching these videos of these confrontations, but how much of this represents the true sentiment out there versus the fringe? Can you tell?
No, it's hard to know. What we do know is that these meetings have gone viral. These social networks all across the country, email chains, have really motivated people and gotten them to show up at these town hall meetings. Now, the thing is, you can't really manufacture this. You can push people to go. You can tell them about town meetings. You can give them talking points, but you can't make them get up and go to these town meetings if this is not something they care about. And this shows just how personal an issue healthcare reform is to people, how much they care about it. And I think it shows, the Republicans have to worry about being defined by their most incivil voices, but I think the Democrats have to confront the fact that people have real questions about this health care reform bill, and they want answers.
Sarah Palin weighed in on all of this over the weekend, calling it downright evil, the health care plan. She claimed that the president would create, quote, death panels that would judge end-of-life health care decisions. That's an exaggeration of one component of the House bill, but the president's trying to battle back against that and saying there's misinformation. Can he win that battle, or is there so much rumor that it's just hard to beat?
And the White House is worried about this. You're right. The president, in his radio address yesterday, called these outlandish rumors. And, of course, those words, death panel, don't appear anywhere in the legislation. And she's pushing the line that it would lead to euthanasia, or the counseling for euthanasia. The bill actually allows for voluntary counseling sessions on a whole range of how to deal with long-term care and end-of-life issues. So that is, according to independent analysts, just false, what she's saying. But the White House is worried that so many claims like this have gotten out over the internet, have gotten people, particularly seniors, worried, and they know they have to fight back not only with the president, but they're going to be putting up a new website this week to confront these questions. They're also going to be flooding the airwaves with ads from their allies, including significantly up to $150 million from the pharmaceutical industry, who cut a deal with the White House on health care reform, limiting the amount of cuts to the pharmaceutical industry to $80 billion. This is what they're getting in return.